You are listening to episode 160 of Mitolife Radio. I am your host, Matt Blackburn, and today I'm interviewing Sebastian Lomas, aka Dr. Seb, the biological dentist. I'm really excited because this is the first episode that I've ever done on dental health. And I've talked about it here and there with previous guests, but I've never dove deep into it for a whole episode. I have friends that are experimenting with a lot of different things, not brushing their teeth, not using toothpaste, all sorts of different experiments. And I was tempted to get pulled into these different experiments, but I'm really glad that I asked Dr. Seb what he thought of these. And I think you'll be fascinated by his dental protocol, how often he brushes his teeth, his thoughts on flossing, oil pulling, tongue scraping, the meridian connection between the teeth and the entire body, how metals affect the meridian system, his thoughts on photobiomodulation on dental health, ozone therapy, and I asked him some listener questions at the end. His thoughts on eating fruit. Can white spots on the teeth be removed? What are the best foods for dental health? What are his thoughts on an electric toothbrush? Should permanent metal retainers be removed? Wisdom teeth coming in at age 29. What should I do? This episode's jam-packed with all sorts of dental tips and practical things that you can implement immediately. And although Dr. Seb is based out of the UK, no matter where you live in the world, you can consult with him virtually. So I'll put the links under the show where you can check that out if you need that sort of guidance. So here we go. Here's Dr. Seb. All right, we're here with Sebastian Lomas, aka Dr. Seb. Welcome to the show.
Thank you so much for having me, and I'm going to repeat it to everyone. And just thank you for everything you're doing and all the information you're putting out there. That people get to make more informed decisions about their supplementation. Right at the end of the day, I know I've learned a few.
I appreciate it. Yeah, and that's why I started this show, is from a place of not knowing and learning, and I like asking more questions than getting answers. And I'm looking forward to learning from you. And this is my first episode on dental oral health. And there's so many questions. And so I just want to kind of open up the dialogue and get your wisdom of working with patients over the years and what's worked and what hasn't. And there's just a lot of ideas out there. Before we started recording, I was telling you about the anti-brushing movement. I know Adam Bergstrom's a fan of the blotting brush, and people say the conventional toothbrush actually harms the teeth, and so Dr. Cowan's been saying. So there's a lot of ideas floating around.
Oh, it's so true. And I mentioned to you, I don't brush twice a day, and I really don't touch the gum line, and very gently, because obviously that's the window into the body, right? That's what allows, if you're damaging your gum line, you're allowing those pathogens potentially, that could be living in the mouth into the bloodstream, and bacteremia going on there. And then, there's the most common thing that every single dentist knows and doctor knows, endocarditis, which is bugs eating your heart valves that come from the mouth, from, most conventionally dental cleaning, which is just unheard of, isn't it? And no one takes a step back and says, well, let's sort out that microbiome before we go scraping all the gum line and making it bleed like crazy.
Right. Yeah. And it's fascinating because it seems like the teeth are connected to all the different organs and glands through the meridian system. A woman messaged me this morning asking about, tooth decay and breast cancer, because she thinks there was a connection there with her dental health causing the breast cancer through the meridian.
Every tooth I take out, or every tooth that's on the Fritz, I always look at the connection between the meridian and the organ that's associated with it. And, you know, there's these really cool bioresonance scans now where you can take pictures of the whole body and you can see these areas of heat showing from the teeth and the face. And then you take the zoomed out one and you see the organ that it's associated with showing the heat or the resonance that's coming from it as well. So for me, that's just, you know, anecdotal evidence showing how intimately connected they are. But then at the same time, we can't really forget about the emotional traumas, and because it's not just the organ and the physical aspect of it and the lymphatic system, maybe not quite pumping and working as much as we can, but actually the emotions that are linked to these teeth as well are a huge aspect of it. So, you know, lung, large intestines seem to be the most treated teeth in the human body from my perspective, which is your first molars. And for me, the lungs are to do with grief. So a lot of grief is being held within those organs as well from those patients that are moving on. And it's something that we have to be careful about saying we're treating because of, but for me, and it's so important to make the connection with the patients and just make them aware of that, to say, look, you know, we can treat this tooth, but actually you need to do some of the work yourself and look into it and take a deep dive into what potentially could be triggering it from the other side of the circle. You know, it's bi-directional.
Yeah, that's a really good point. So when and why did you get into biological or holistic dentistry?
Oh, it's such a crazy story, to be honest with you. And I'll try and keep it like, I'll try not to get too emotionally invested in it as well, because but for me, so when I was younger, I was good at science. My parents were always like, well, what do you want to do? Do you want to be a doctor? Do you want to be a physio? Do you want to be a dentist? You know, the usual, you know, things. And I said, well, I don't really know. So I ended up doing the other one was chiropractor. I was like, okay, so I'll go and do some work experience. My parents were very practical. I did a bit of work experience in all of these. I must have been like 12, 13. And, you know, on the half terms, went and sat in and which one, you know, got my fancy. And I actually met this, in England, we have the National Health Service, and it was a National Health Service dental practice. But the lady that ran it with her husband was very inspirational, and she wasn't truly biological, but she was very holistic and meditative and spiritual. And she would prescribe meditation to her patients, and you know the levels of change within her patients were huge. And obviously, that made me think, wow, you know, this is so interesting. And for me, the hook in that type of dental field was when she would take someone instantly out of pain, you know, and I don't know if you ever had toothache, but you can't get away from the pain, the throbbing, anything, can you? So, you know, it's one of those instant gratifications that people will thank you forever, because you've gotten them out of that pain that they've been in for a day or two or however long they can cope based on their tolerance levels. So then I was really bought into the intrinsic factor of helping people. And I ended up working at this dental practice for 4 or 5 years doing reception, dental nursing, you know, planning things, just seeing treatment planning. And that's what hooked me in. But this was the conventional way of working. But I actually turned 17 and, you know, partying and girls and whatever. I boxed quite a high level. So I did a lot of amateur boxing, and it got in the way of my grade. So I didn't get into the universities that I applied for based on my A levels in the UK. So then I went and took a roundabout journey into studying biochemistry, right? And then that's led me into how our cellular functions work, which has been fantastic in biological dentistry and detoxification. And I'm sure we'll come on to that later from certain treatments and protocols. And I met my wife at this after that degree, because I thought maybe I didn't want to be a dentist for the reasons I thought I did. Maybe I wanted to earn some money, and that was it. And I went to London and, you know, had the stressed out lifestyle, the treadmill lifestyle, and I looked forward to one day a month. And let's not get me wrong, I was really successful in the job that I was doing, working in this IT corporate, but it just did nothing. And then I went traveling prior to going on this graduate scheme after university. And I got really ill. I went to Argentina, Brazil, Bolivia, ended up in intensive care in in Bolivia and had severe altitude sickness, pulmonary edema, which is where your lungs are filling up with mucus and you can't really breathe, and then a heart murmur because my heart couldn't get the oxygen to places, and then pneumonia on top of it. So I was in intensive care in Bolivia for a week, and missed all my flights. Oh gosh, yeah, absolute nightmare. Came back to the UK and then started that graduate scheme, met my wife, and then we had this period of illness, and I was very scientific, and I was like, no, it needs to be pharmaceutical medication. I've got private healthcare, so we can go to the top doctors and do this and do that. And none of it was working. A year later, none of it was working. And then it was my wife and her family, my girlfriend then obviously, and her family that I didn't listen to for a year, saying, well, have you tried, cleansing and restoring the gut microbiome? And have you tried, homeopathy? And have you tried this and that and the other? And it just opened my eyes to an alternative way of looking at things and, cutting out things and doing tests to see what's going on in your system. And that's what opened my mind to holistic in general. And it started working. And I was like, whoa, blown away, mind blown moment. And then eventually I went to this immunologist and said, I'm there, but I'm not quite there in terms of my health. And he said, well, what's your purpose in life? What are you doing? And I said, well, I'm working at an IT company. He said, well, what did you always want to do? And I said, well, I wanted to be a dentist. And he said, well, go and do it then. And he put me in contact with the admissions in the university in London. And that's what got me back on the path to dentistry. And then during that degree, because of my holistic awareness, I was studying the conventional way, but then learning from all of the biological. And when I say all of them, there's not many of them. Let's say in the whole of the UK, there's probably like 5. So I was spending my evenings and weekends and half terms and reading weeks, whatever they were, learning the different way of dentistry. So it was a very convoluted journey, but the journey and the path that got me there, I picked up so many transferable skills that I've used in my clinical practice. So it's just amazing when you look on it. In the moment, you get so angry, don't you? Like, I can't believe I've got to do this and that and the other. And now on reflection now, I say, without that, I wouldn't be who I am and what I'm doing, which is just crazy.
Did you say there was only 5 holistic dentists in the UK?
5 true, because we can probably get onto biological holistic dentistry and the pillars of it, right? But for me, there's these clinics that are set up to do it, and there's probably 5 main clinics that are all holistic dentistry, and there's some that are blended with National Health Service, and there's some that do parts of the pillars of dentistry, some that don't. So, but then how can you be, you only know what you know, don't you, at the end of the day? So having the ability to do all of it, I guess you've got to take that step back and relearn other areas and look at other things and try different things out with your patients. But yeah, for me, there's only 5 true holistic, maybe less, 4 or 5 true holistic practices with each a few dentists in the UK. And don't forget, we've got the National Health Service here. So that's a big overriding drive for most patients that don't look outside of that, because that's the way that they believe, that's it,
That's wild. Yeah. When I lived in California, I was there for 30 years. I remember there weren't many. Like, there's some in LA. You could drive to Tijuana, Mexico, and get treatments. And there's a dentist that put, amethyst in quartz in instead of mercury fillings, and that was really popular. But often going to Mexico to get dental treatments are scary for some. And then I've talked to some people and be like, it's the same as getting it in the States. They're just as good. It's just cheaper.
Yeah. Cheaper, maybe without the overriding, general. We in the UK, we have the General Dental Council, and you have the American Association of Dentistry, I think it is, ADA, and that they govern a lot of what is evidence-based treatment. And to do dentistry outside of that is more risky for your insurance, for your indemnity. If things go wrong, what could happen and who backs you? And in Mexico, they don't have that. So in Mexico, you can just do your type of dentistry, and it is because you want to do that dentistry and the patients come to you, then that's okay. Because there's no one going to say you're doing things differently. So I think that's the big drive for the Mexican dentists, and a lot of the Americans set up in Mexico. I've seen.
Yeah. The cost seems to be just astronomical from what I've seen, to where most people just go to the conventional, dentist because they have health insurance, and they're definitely not getting a biological holistic treatment. There's some negative side effects there potentially.
Well, this is it. Yeah, and it depends, because obviously the services that are covered on the health insurance, I guess it's different in America, but similar to the UK, because we have the National Health Service and everyone pays their taxes, and they go into that and they expect that that's the treatment that they deserve, and it's really good treatment. And in America, you will pay for obviously the insurance, and you only want to you don't want to pay more to do outside of that because you're already paying for that, right? So then you're kind of thinking, wow, so I've got to pay privately for the type of care that I want. And obviously some of the health insurances do cover the type of dentistry, and it's just all got to be written and printed and invoiced in a way that doesn't look outside the norm, I think, a lot of the time, is what I've heard from a lot of patients around the world. But it's similar but different. And I think nowadays with podcasts like this and information online, patients that come and see me are so educated already with, like you saying, the quartz glass fillings and what potentially could go in their system. And here's something that we're just going to go off topic here, that you were talking about the meridian lines and how the teeth are connected. It's also connected to the chewing function of. Okay, so firstly, let me rewind. The meridian lines, to activate the meridian lines, like you're saying, teeth are crystal. So if you're having metals or things that block the light from when you're chewing, you're not actively feeding that meridian light system of energy to make it flow. So that's one thing. So that's a huge part of what I do, removing metals to it. And whether that's the esoteric way of me saying it's going to open up those meridian lines again. But then the other thing is, when you're chewing and all your teeth meet, they're actually moving within the ligament within the jaw. And then there's some studies that show that is actually pumping the craniosacral fluid within the brain to try and clear and pump and make things work and function. So then that comes to the point of, if the teeth aren't all meeting in a nice even line and you're not pumping the system as you should, and don't get me wrong, I've still got my wisdom teeth that have never come through, so I'm not even pumping those meridian lines. So, and interestingly, they're linked to heart, and I've had those heart issues that we were talking about in Bolivia earlier. I had the heart murmur, and it's just funny how these things, you can never make a scientific study based on a case study yourself or anecdotal evidence, but it does. And when I was playing a lot of competitive sport when I was younger, doing my boxing and my football or soccer, as you guys call it, I always got tested for my heart because I had an atypical beat. So it's just, you make these strange connections, don't you? And reflection, and you think, couldn't it? But yeah, it's fascinating stuff. But likewise, I've had patients that have had, let's say, bladder issues, which is the front four teeth, upper and lower, and they've just wanted all of those teeth out. And I didn't feel comfortable taking them out for them because there was no signs at all, and they tested right. There was no infections, nothing like that. And some other dentists did, and they still had the same problems afterwards. And that's where it really comes down and breaks your heart, right? That you've got to draw the line between what you can advise patients and not. And you've got to say where you stand, because that's a big issue, losing your front four teeth.
Yeah, it seems like the conventional system likes pulling things out. Let's pull out the appendix, let's pull out the gallbladder, take away your bile production, which you need to absorb A, D, E, and K from your food. It's just they're pulling out these essential things. It's pretty wild.
Yeah, it is wild. It's wild. And for me, the system, like we were saying, the images that you can take and the things that you can do before you get to, but I think the problem is, it's easy, isn't it? Just to say, that's hurting, that's causing problems, let's take that out, let's no more pain. But then, like I was saying earlier, before we got on to jump on, I'm sure we'll talk about these things later, that in 5-10 years, what's that knock-on effect going to be in the rest of the cellular system that was working so joined up before that happened? And it's just really a warning for you guys, for your body to say, look at something else, what's going on. Let me change my food, let me change my nutrition, let me change the supplementation, these type of things that could have been skewing your system to the other way, and really you've done the wrong thing by taking it out. And don't get me wrong, sometimes maybe you do need to, if it's a last resort and you've tried all of those things, but who can hand on heart say that they've tried absolutely everything before having the organ removed? And yeah, it's a fascinating journey to go on. But ultimately, what I don't dictate, and biological dentists don't dictate what treatment a patient should or shouldn't have. You present all of the options, you present in fully informed consent, and you say, this is what it could cause, and I'm sure we'll come on to those things later, but I understand if you want to do it and it's your body, your choices. And that's the main thing. And there's so many things that could be triggered from some of the things that you're just not even talking about. Like for me, metals within the mouth is a huge thing. And, most metals, there's no place in the cellular systems, is there, for how we function. And oh gosh, yeah, it's a crazy story. So there's so many things, but I'm sure but to be fair, let's talk about it now. Number one for me is metals being present within the mouth. We're talking about the far out esoteric way, which is blocking the meridians from activating and pumping. But before that, when you've got a metal in your mouth, there's going to be some leaching of the metal, some corrosion. There's going to be a galvanic current if you've got two of them that run between your saliva, which is mineralized, that will form an anode and a cathode. And the frequency and the hertz that they run on is similar to the neural tissues that your body functions on. So how that disrupts the nervous system must be huge. And then not to mention the meridian lines that they're on as well. So yeah, it's fascinating. And we work with acupuncturists that are specialized in this to go and all of the practitioners, not just any practitioner, holistic practitioner, to really understand how that could be impacting their system before we do anything.
Yeah, one of the first things I learned about when I got into holistic health or alternative health 12 years ago was the mercury fillings and how harmful those are. And I remember seeing a video on YouTube of someone drinking a soda, and back then I was really anti-soda. I think they have somewhat their place, not the diet crap, but it was causing that metal to off-gas, the phosphoric acid interacting with the metal, and it gassed for like hours afterwards. I forget the name of the video, but it was a pretty viral video on YouTube at the time.
Yeah, I think it's called the smoking tooth or something like that. I remember it as well.
Yeah.
And okay. In England, these fillings are not called mercury fillings. I don't think they're called mercury fillings anywhere in the world. They're called silver fillings or metal fillings. And the ironic thing is they have 53% mercury in them when you're mixing them. So the mercury is obviously a liquid which is shaken and binds together all of the other alloys within them. They all have different combinations of them, but for the most part it's silver, tin, copper and zinc, and obviously mercury is the glue within them. And they say when you place them, when you remove them, is the most toxic time, which it probably is, because the mercury is in its liquid form, which is the thing that kills you. When you think about when you go into I just remember in school and someone breaks a thermometer and you clear the whole place, and it's because it's got the mercury in the end of the tube, and you have to have hazmats, and no one's allowed back in until it's all been windows for hours, and yet we place it in someone's mouth. It just doesn't make sense. The problem is it makes sense from a keeping the tooth in function perspective, because it's one of the best filling materials ever, because it's so toxic to bacteria right? I see mercury fillings in teeth, that the teeth fail before the mercury fillings because they're just wedged into the tooth, because obviously there's nothing holding them in. If you drew a perfectly 90-degree, like kind of rectangle within a tooth and you just put metal in there, mercury, it would just fall out. So what they have to do is they have to, make a little wedge at the bottom or the top so it doesn't fall out. So it's got an undercut in there. So what you find happens is the teeth break around the metal filling and no bacteria can get to the tooth because the mercury is so toxic within the gaps of the tooth. When you remove them, there's so many dead, it's just so stained. And I'm guessing that's from necrotic tissue from tiny bugs and stuff dying around it, and leaching of the metals within the porosities of the tooth, obviously. But it's not just when you're having sodas, it's when you're having anything hot or cold, because you're changing the temperature of the filling itself. So you're changing the properties of it. It vibrates more or less and releases a bit. It's the current that's running through the mouth when we're talking about that galvanic current that runs from one to the other. And you can actively see this in someone's mouth, where you've got shiny ones and then you've got corroded ones. And it's the corroded ones that you're noticing. They're going to be the ones, off-gassing more and more and more. So yeah, it's crazy. And obviously mercury has no place in our system as a potent neurotoxin, which is just crazy.
Have you ever looked into or used pulsed electromagnetic field therapy for getting at the critters in there? Because I guess one thing you just made me think is, I guess if you kill it with PEMF or zap them and it penetrates the bone, they could just die in there, and it's kind of the same situation. But I guess you're not letting them live out their full life cycle, which I imagine would help.
Yeah. I mean, do you mean with the filling still left in, or?
Yeah. Have you ever seen any patients, you can buy like PEMF paddles that I used to use it on my jaw when I was first getting into it. And I thought I felt a benefit, just a negative polarity, pulse zap every 5 or 6 seconds going across my jaw.
Yeah, well, I can't see why it wouldn't do that. But then at the same time, are you maybe influencing how the metal's reacting within the system as well, on that point, therefore maybe releasing a bit more of what's going on? I don't know. I've not looked into it enough, Matt, but it's a really good point.
Yeah, whenever you have metals involved, I like what you said about the frequencies and the hertz running on similarly to the neural tissues, because you can create secondary frequencies, it's with EMF blocking clothing. One of my friends told me about that. So it gets complicated when you have metals and EMFs, and you really don't know what's going on, what harmonics are being created or whatever.
No, it's true. And you don't know how any of it's being bounced around and what it's affecting. But there's been studies now that show if you're on your phone, right, and you've got metal within your mouth, when you make a phone call, the first place it goes is to the metal, which is going to obviously activate more release or stronger currents. And then it goes to the cell tower. So, for me, being metal free, especially with the advancement of the composite fillings, or composites as you guys call them, and the thing is, what we've got to understand is that nothing's a great substitution for the tooth material. It's always a secondary to that. So like even with the quartzy, we call them glass ionomer fillings that have quartz within them and glasses and stuff in them. They have small amounts of aluminium or aluminum, and they have small amounts of fluoride within them, which are used within the binding process. But once they're used, if you're not using fluoride toothpaste, not drinking fluoride, you're not going to be re-emitting it back into your system. So nothing, even the best biocompatibility ones are never amazing. And even the BPA-free composites that we use, which obviously you don't want BPAs in your system leaking estrogen mimicking compounds all the time, they have adhesive glues within them that you have to stick to the teeth. So there's so many, and I say this to all my patients, I'm telling them exactly what's going into their system. But for me, it's got to be better than a metal that could be an EMF antenna or leaching negative things into the system that could be causing cellular disharmony. So they're the things that I kind of mention to them. And obviously it's within their realm to go away, research and read the books and understand, and then make their own informed decision, because nothing's perfect.
Mm-hmm. I remember reading this book called The Calcium Lie, and he was really anti-dairy, which I don't agree with, but he said that the teeth or the bones are actually made of about 12 minerals, probably more, because I think people tend to think that the bones are all about calcium and that's the main component. But he was saying there's all these other things in there. Can't remember. I think it was iron, magnesium, potassium, copper, so many pieces. Mm-hmm. So I was going to ask you, like, is like Weston A. Price, the dentist, he was really about fat soluble vitamins and activator X and K2. And I think that's a piece, but it seems like there's a lot of nutritional components working together. And is your perspective on dental health that it's largely an inside job? Like the teeth are nourished from the inside with these nutrients and they're getting recalcified maybe and kind of nourished through the roots?
Yeah, I mean, actually, this is going to be a huge topic, Matt. So I guess we've unlocked the beast right now. So for me, you've got the outside job and you've got the inside job. Okay, like you just said, that it's the germ theory and the terrain theory, and I think it's a mixture of both, because we need a healthy terrain and environment to nourish the teeth, and that's from the inside out. And this blew my mind that I think what it was absorption. So this is about the lymphatic flow of teeth, and they did a study, and it was from the gut, and they measured the lymphatic flow from the gut to the pulpal tissue, which is the inside, the living part of the tooth, and it took like an hour to get from there to there. And I think they do some fluorescent dyes or whatever it may be. And then what they looked at, does this dye come out of the teeth or the individual tooth? And so let me put it into perspective for you. You've got the pure organic bit in the middle of the tooth, which is the roots and the blood, within the roots, which is the nerve and the blood supply. And then you have this layer called dentine or dentin, I think you guys call it, which is like the porosities of the tooth. And it's like 70% inorganic, but 30% organic. So which is like all of the water flow and stuff like that. And then you've got your enamel layer, which is the strongest thing that the human body has. Plus, actually, dentine is stronger than bone. I used to think bone was, the strongest thing. But the dentine and enamel, both stronger than bone, which is just fascinating. But they're being constantly nourished from within inside the tissue with all of the minerals, the nutrients, the lymphatic flow, stopping bugs from living within these porosities. So really, you could look at the disharmony within a tooth or decay or, toothache. And I guess maybe let me just rewind to the germ theory. Conventional way of thinking is you have bacteria and plaque that lives on the tooth. It destroys the tooth when it's eating in fermentable carbohydrates, and they release acid and they start dissolving the tooth. They get in and they get to the nerve and blah, blah, blah. And I think in reality, it's probably a combination of both, because we've got to nurture the oral microbiome, but we've also got to nurture the terrain of our own system. And if we have a healthy lymphatic flow from within the tooth to without the tooth, nothing can live in there. It can only live on the outside because it's supporting it and pushing it out. And that's where you're getting to all your minerals, your A's, D's, K2s, nutrients, your good immune system. So isn't that just amazing, though, that that's how living the teeth are, right?
Wow. So are you a fan of like lymphatic exercise? Because I noticed there's kind of a anti-cardio movement. And over the years, I've been enjoying a mini rebounder. My first one I bought on Craigslist for $10. And, I've messed with the vibration plates. And I think there's something pretty powerful there for overall health. And it's probably really working on your dental health, right? When you do stuff like that, even just walking.
For sure. Yeah, for sure. Because if we're not moving, our lymph system is not moving, because our lymph system has no pump like our heart. It's just the movements that you do that push it back towards the heart to detoxify. So going back to the living within the tooth, you've got that plaque theory living on the tooth. So don't get me wrong, if you have bugs living on a tooth that are pathogenic and the microbiome isn't perfect, they are potential and their risk is higher to cause dental disease. And obviously there's been some that have been shown to cause decay, which is this Streptococcus mutans and and you've got Porphyromonas gingivalis, which causes gum disease. But actually, what comes down to the microbiome balance is if you've got metals within the mouth, and let's talk about mercury, because mercury is a potent antibiotic. Not many bugs can live in that environment. So if you've got lots of that in your mouth, only the bad bugs can live in there. There's no nice commensal bacteria that can have fun, and they're the ones that remineralize the teeth, don't forget. And that's where we're coming down to this anti-brushing movement, because if you get all of the balance right, then you actually have bugs in the mouth that cause remineralization, rehabilitation of the mouth and the gums, and stop the leaky gums and stop the demineralizing of the teeth. And I find that there's other factors, and for me, mouth breathing, has got to be one of the biggest factors in terms of no mineralization on teeth and allowing plaque to rest on there more than not, and allow calculus to build up within the mouth. And let's not forget, if you're mouth breathing, you're evaporating the saliva from within the mouth, which then actually your own saliva has its own immuno system, and IgA is its specific immunoglobulin, which is part of your system, which actually goes in and attacks things in the mouth that shouldn't be there. And if you've got no saliva flow, you've got no balance within the mouth, and then you've got all the minerals that are released as well. And you'll always be able to tell if you're a mouth breather for one or two reasons. If you're not aware of it already, you have very dry, cracked lips, no matter the time of the year, usually a lot of the time. But also you have lots and lots of calculus buildup, the hard tartar that builds up on the teeth, especially behind the lower front teeth, because that's the first bit when you're mouth breathing that dries out, and you'll have lots of staining on your top teeth. So it's just really interesting. They're super easy tips that you can just try and. My mentor, John Roberts in the UK, was like the founder of smart removal of amalgam therapy, amalgam fillings in the UK. And his one and only saying is lips together, tongue to the roof of the mouth, which comes onto the lymphatic thing in a minute, and breathing through your nose. And the tongue to the roof of the mouth, I go through an 8-week intensive airway kind of stabilization with my patients. And I'm sure we'll come on to that in a bit later. But one of the main reasons for this is that your tongue is like the biggest defense and movement and muscle. It's like eight intrinsic muscles within 4 intrinsic muscles, four extrinsic muscles within the tongue. They pump the lymphatic system just by doing these exercises, holding it in the right place, swallowing it in the right way. And that drains all of these glands on the neck and the ears. And yeah, so going back to lymph movement, I'm huge, and the rebound is huge. And yeah, I know that was a convoluted process, but I love to talk.
No, that was awesome. I had an episode several months back on tongue ties, and that was fascinating to me. That's a whole rabbit hole, tongue ties and the corrective surgery and all that. That was mind-blowing.
We do that in the UK as a dentist. We as a biological dentist, that's one of the pillars of it, really, which is it's the epicenter of development in kids, and it's the epicenter of good health in adults and good sleep and good restfulness. Because if you've got a tongue tie, your tongue can only be tethered to the lower. So for those that don't know, a tongue tie is where when you stick, if you open as wide as you can and you lift your tongue to the roof of the mouth just behind the front teeth, can you reach it or not when you open as wide as you can? And if it's 50% or more tethered from that, then you're more likely to have a sleep disordered breathing, not getting into that deep sleep cycle because you could be potentially clenching or grinding your teeth at night because your tongue would be in the airway. And it's really hard to try and explain into your mind's eye, but the airway at the back of the throat is made up of the back of the tongue, because when you stick your tongue out, that's only the anterior 2/3 of it. You don't see the posterior 1/3 of the tongue because it goes down the throat. And if you imagine, if your tongue is tied, it's in the lower jaw, it's got a more bulbous back of the tongue that pushes into the airway. And obviously the back of the throat, the back of the airway is made up of your spine. And so posture is huge in breathing as well. So if you have your tongue up and out of the airway, it creates a huge amount of space. And we can measure this on 3D x-rays now. And if you have less than 200 millimeters squared of volume at the back of your throat, you're at higher risk of a collapsible airway at night, meaning that you're more likely to put pressure on your teeth at night to stay awake, to stay breathing, which to me is you're putting your body into fight or flight every single night, removing yourself from the deeper sleep cycles. So not really getting that rejuvenation and restfulness that you need to repair, because otherwise you're constantly in that breaking down state, which is just incredible, isn't it?
Yeah, recently I had the COVID thing, and I was experiencing a pretty bad sore throat for the first probably 3 or 4 days, and I still have a little bit of a dry cough. But I'm a nose breather during the day, but while I sleep, I'll have intermittent times where I mouth breathe. And so over the last few years, I've been playing around with mouth taping. I had an episode on that. There's a company, Somnifix, that's pretty good. And then nasal passage openers. That's what I used the last 5 days, just to make sure that I was able to nostril breathe when I was congested, and I was dealing with all the symptoms. I think the company is called Muse or something, but I put this thing up my nose and it kind of just expands my nasal patch. Oh, cool. Yeah. I feel amazing using that. And I prefer it to the mouth tape. It's to me a little more enjoyable.
Yes. It's actually part of one of my protocols because, when you're trying to, so 80% of people that I see will show some signs of sleep disordered breathing on their teeth, which could be, breakages at the gum line. It could even go as far as gum disease unexplained, even though their oral hygiene is amazing. And because they're putting so much pressure on their teeth, it's rocking the ligaments within the teeth and the bone. And you normally see the bone loss at the top jaw, because it's the lower jaw with the denser bone that's bashing into the top. Or people that actually protrude their jaw forward to breathe at night, you'll see all the bone loss at the front teeth, and you'll see, and this is just simply mechanics and pressure that's being put on them. But part of that journey, doing the exercises, trying to get the tongue to live in the roof of the mouth, is only mouth tape when you're, look, don't get me wrong, I love mouth tape. But if you do have this sleep disordered breathing tendency with low tongue posture, and you've got a collapsible nasal valve, so for example, if my lips are together and I breathe in really deeply, my nasal valve collapses. And that's because I used to box a lot when I was younger, and I broke my nose and I had a deviated septum, and then I had it corrected, but now my cartilage is all ruined because it's not strong enough. So if I don't wear nasal dilators while I'm sleeping and I'm mouth taped, I'm almost giving myself sleep apnea, because I can't breathe through my mouth, which is the fail safe, don't forget, because when you need to breathe, you open your mouth to breathe. But if I'm lying on one side and my other half's actually woken me up a few times, because we've been mouth taping now for like 4 or 5 years, I think, or maybe not that long, maybe 3 years. But and she's like, you're trying to breathe through your mouth, but you can't breathe, and you're not breathing through your nose. And she's woken me up a few times, and then it all just clicked. And I was like, I need nasal dilators. So I sleep in them every single night. And I get my patients, when we're going on this 8-week transformation of like airway stabilization is what I call it. You need to have your nasal dilators, you need to have your mouth tape. But I also get a lot of patients that have a deep bite, that have a locked in jaw. to get them wearing these appliances that opens up the lower jaw to move the lower jaw downwards and forwards while we're training the tongue as well. Because it's not just the tongue and soft tissues that can get in the airway, it's the skeletal structure of the lower jaw. Because if you have a chin that's set slightly further back on your lower jaw, you're at more risk of sleep disordered breathing as well. So there's so many factors, and mouth tape is one simple quick fix, but it doesn't work for everyone because of the soft tissue not holding it in the right way, the nasal collapse, but also the skeletal structure of the jaw not quite being in the right way. So there's so many more things. It's like I remember this at school. You do A levels. In the UK we do at school or high school we do biology, and then you get into your next college and you do biology, and then within that biology there's like 100 million subjects, and you think, how can biology contain all of these different subjects when it was just cells and plants and things like this before? But when you take a deep dive into something like you do, Matt, you open up this window of everything, don't you? So I sleep in nasal dilators every single time because my nose collapses too easily.
Wow. I've heard I had a friend that said when she was mouth taping, it was like training wheels for her. Like she did it for a month or two, and then now she doesn't need it at all. Have you ever seen that with friends or patients, that they can act like training wheels and you could retrain your body to nose breathe to where you don't need the nasal dilators anymore?
I think you can, and I think that's obviously, I guess my problem is, unless you're filming yourself at night, how do you know?
Mm-hmm.
And
right.
For me,
you have to have a partner.
Obviously, yeah. And for me, obviously, you can wake up with a dry mouth and you think, yeah, okay, maybe I was mouth breathing last night because it's all evaporated, and that makes sense. But sometimes if you're breathing at the beginning through your mouth and then you wake up and you're not doing it towards the end, you wouldn't know whether you had been or not. And for me, I guess it comes down to the body chemistry, doesn't it? Because if we're breathing through our nose 24/7, which is more likely to put us into a rest and digest state. Well, not strictly true, because obviously either nostril, your right side does your fight or flight and your left side does your rest and digest, your parasympathetic. But if you're breathing through your nose, you've got good sinus clearance, and the little holes between the sinus and the nose are open, and they can be easily blocked from a dental treatment and contraction of the dental arch and high palates and things like that. But if that's open and you're mixing with nitric oxide, which again dilates your blood vessels, gets you into that place of, and also as an antiviral, antibacterial, the nitric oxide is amazing. And then you're going to your adenoid tonsils, and then you're going to your palatine tonsils, and then you're going into your lungs. For me, it's not worth not mouth taping at night anymore because of that risk of not quite knowing. And I've experimented with it all the time, and I don't know whether it's just psychology or not. When you're not mouth taping, you wake up and you're like, do my rest as well? Am I doing it? So is my snore score as good? Is it not? Is my aura ring showing that? It comes down to these things.
I don't like shaving every day, like especially my whole beard down to the skin, and so that's why I prefer the nasal dilator to the mouth tape, because I haven't seen a mouth tape yet that works with the beard. So
no, they don't. I don't. And I used to have a massive beard before COVID, and then we have to shave now every Sunday for our masks to be sealed. Although those restrictions have been relaxed a little bit, at least.
So I wanted to ask you, have you seen people reverse receding gums? Because this seems to be a big issue. And from what I've read on receding gums, it's just something that people, as you age, you have to deal with it. And it's just something that's going to happen. That's been my research on it. But it seems like there's a way to heal it, right? Like you alluded to that a little bit with the mouth breathing at night, how that can kind of push the or inflame the roots of the teeth. But just curious your general thoughts on receding gums. Have you ever seen anyone reverse it?
So it's really hard. So for me, receding gums, easy to halt it and prevent it, harder to reverse it. And in my experience, and I'm open to many things, and there are surgeries that can be done taking stem cells from the blood and opening up the gum line and pulling them down. But is it worth it at the end of the day? I don't know. It depends on the person, the patient, and things that you want to really consider. But for me, we've got to get to the root cause of the receding gums. And number one is it just the nutrient mineral balances within your system, and that the ligaments aren't nourished as much as they should be, and they're not able to hold on to the teeth? Because when we bite on a tooth, our tooth has actually got 0.2 mil shock absorbent system, because otherwise it would fuse to the bone. And really weird story, if you have a trauma and bang your tooth and it actually fuses to the bone, within that period of your bone remodeling, your body will push the tooth out. So in that 9 months, if your tooth ever fuses to a bone, it will actually remodel and push it out, because it says it's not fit for purpose anymore, which is just an interesting thing to consider there. So we need this ligament spring system within our body to survive. Now, then we have to look at, well, what causes receding gums? And, yes, we've got to nourish them with all those, A's, D's, K's, C's, vitamins, all of these vitamins, and obviously the right fat soluble, meats and vegetables, the balanced, as balanced as we can be. But then we've got to look at pressures within the teeth that are being exerted on the ligaments within a certain way. So if you have a tooth that's slightly rotated and it's taking a hammering in a position that's not normal for it, you will see the gum recede and pushing it down or out of one way that it shouldn't, because the pressure's too much. But as simple as that is, just from that clear picture there, if you have someone that is stressed and putting lots of, well, the other thing with stress is it's an inflammatory, low-grade inflammation, isn't it, within your system? Neurologically, you're releasing those hormones within your system and chemicals. So then that causes inflammation within the airway. This is my theory. And that makes you more likely to have a more narrowed airway and put more pressure on the teeth if it's more collapsible at night. And when you put pressure on your teeth, those ligaments can only take so much. And so at first, usually this is what I see within my patient base, that the ligaments themselves start to relax and people start to get sensitive teeth, because the air and the water can go into places that it used to not be able to, because of the tightness of the ligaments surrounding the roots of the tooth. Now, after a while, and depending on patients' swallowing habits and sucking bacteria into these areas, and the microbiome, it can go into bone loss. So the first gum problem is something called gingivitis, which is just inflammation of the gum, and that's totally reversible. You've not lost any of your bone tissue that's holding your tooth in. But if something's been bubbling away for many, many years, and normally you get no symptoms from it, and if you don't get regular checks, you wouldn't know, you then start to get bone loss within the teeth. So then you can eat, because the gums have migrated down the length of the tooth. Obviously, you've got your sensitive teeth, but then you've got less of the ratio of the root held within the bone. So the teeth start to wobble more. They also start to get bugs within them. And sometimes you can have a gum line that's still pretty high up on the tooth, but if you've got a big pocket, we call it, a pocket between the gum and the root, down to a gum between the root and the bone, a big pocket there, and it's not been cleaned out, that is actually something waiting to happen that you don't even know about. So you have to be so careful of getting them regularly checked. And that can come from the pressures that are being on them, the bugs that are mixing within there, and the reaction of your body to these bugs. Because what happens is when you've got bugs living between the bone, the tooth, and the root, and the ligament, or just above the ligament, your body says, I need to fight you, and I need to send a whole army there. So it's almost, gum disease is almost an autoimmune condition. So because it's trying to fight off these bugs, but at the same time, the collateral damage is the bone. So then it retreats and then you lose. It's like a vicious circle. So for me, if someone ever has major gum disease unexplained and they've been to all the specialists and can't really work out what's going on, for me, it's the pressure off the teeth just to wear this appliance, to understand, just to limit that, to give those ligaments a relaxation, using the best gum treatment that we can. And nowadays we have ozone therapy, which is, I know you love it. And we use ozone water and ozone gas within the pocket. And we use red light therapy within the gum as well, which is a diode laser at 870 nanometers, which helps with photobiomodulation and healing within the gum tissue and reduction of the inflammation and the collateral damage that occurs. And then you review it, and then hopefully it's stabilized. But then obviously you've got the gums that have receded, and people need to be aware that when you have gum disease that's not showing and you have the treatment, because it's that inflammation is keeping the gums at the height that they were. Once you remove all of those factors, the gums recede back to a healthy attachment point where they've not got inflammation, but then you've got a receded gum. So then you really are at the crossroads and you have to say, well, okay, what do I do now? Am I happy? Is it fine? My teeth are strong. You don't see it, so it's not a big deal. I know how to keep it clean, so it's all right. Or do I try more holistic methods of, for me, you've got to try and initiate periodontal ligament migration back up the tooth, which is a really impossible thing to do. And I've not seen it heal with someone not doing a surgical intervention introducing these stem cell type plasmas from the blood that we take from the arm on their own. And even when we do that, it's not 100% back to normal. You start 100%, but it probably goes to drops 20% of the height again, because you're trying, and obviously you don't want to be doing that type of surgery unless you're happy with how your body's functioning and the health of it. If someone's not in a well-balanced state, you're going to not get as good a result as possible. So yeah, there's a lot to think about, but I would love to know if anyone has done that themselves. And, I've not seen, but I've heard of oil pulling using wheatgrass, which has been fantastic for some patients. But again, that's not regrown the gum tissue, that's stopped the gum disease. And coconut oil pulling is an advocate for me. Every single routine for me should have coconut oil in their life.
That's awesome. Yeah, we had a few questions on oil pulling, and I'm glad you brought up ozone and red light therapy because those are two things that I use here. And I love swishing with strongly ozonated water. It just feels so amazing in my mouth. And I have tried the gas attachment straight from my machine, like the little, it looks like a little mouth guard you put in your mouth and it puts the gas right in, I'm sure you know. And I tended to breathe it in. I don't know what I was doing wrong, but for me now, just the swishing with ozonated water is so much easier and safer because I've inhaled the gas using that mouth attachment multiple times, and it's really not fun to breathe ozone.
No, it's so reactive, isn't it? And obviously our lungs ozone is so safe apart from in the lungs.
Yeah,
that's it.
And even then, it doesn't cause permanent harm to the lungs, right? It just irritates them. So
yeah, exactly. They've not got very good antioxidant levels hidden away in there, do they? So you have to wait for it to kind of peter out. But yeah, ozone water for me is amazing for, especially getting into those pockets with patients that have those gum problems, and then using, because obviously you've got O3, haven't you? You've got that scavenger oxygen that goes around cleaning it all up. But if you then activate that with the red light, it does even more, and it releases more of the O's to do that. So it's like an initiator within the pocket. So yeah, it's an amazing. I wish I could take credit for all that treatment. I have two amazing therapists in our practice that do that for me and focus on the gums and only the gums. So I'm a bit out of practice, and even in dental world, we have specialists within the gum treatments, but for me, the therapists that, have done extra courses from doing the hygiene can actually do this for patients. And unless those patients need surgery, I think when you come back and you do all of the things holistically, patients don't need surgery unless they want to regrow their gum and influence the position of the gums, because the body heals so well. And you'll find that the bone attachment, in some cases, just from using the diode lasers and the ozone, say someone's got 80% bone loss when we first start treating, by the end of the treatment, 3 months to 6 months, you can regain 30% of that bone in some cases, which I've seen anecdotally. This hasn't been proven in studies yet, but for me and treating patients, it's been incredible. So that's really growing the gum and reinitiating the periodontal ligament again, isn't it, to influence and rebuild?
That's awesome. Yeah, the last couple months I've been playing around with cold lasers, class 3 cold lasers out of Denmark, and it's 808 nanometers. I'd not heard of the 870, so that's interesting. But they have a dental attachment that I want to get that you just hook up onto their little pen, and you could beam that, on your gums or wherever. And I'm looking forward to integrating that with the ozone water and see what happens.
For sure. Yeah, for sure. Because all you're doing is you're influencing the good cells to good inflammation to help clear away all the old cells, right? To regenerate, return over, and support the microbiome in a positive way. So yeah, why? It's amazing. I often use my equipment on myself.
That's awesome. And so I would imagine you're biased, but I think we had a few questions like, are regular or once a year checkups necessary, or what are your thoughts on that in general? Because a lot of people are, trying to be their own doctor and their own dentist and their own everything. And I know there's different schools of thought on cleanings. I know my friends down in California, they did a 40-day orange juice fast years ago when they were raw vegan. And he had this story that his teeth were just stained and he was freaked out. He thought it was permanent. And then he went to the dentist and he just cleaned every other tooth and showed him with a mirror that he looked like a jack-o'-lantern. And he said, here, I just had to clean your teeth and they're not permanently stained from the orange juice. And
wow.
Yeah. So
I've not heard of that one. That's pretty cool. So for me, you need someone nowadays, a professional that's on your side, thinking the same way that you are, because it's not a one-way. It's not a one-way. I tell you this is what you need. It's present the information and understand, and But for me, it's so important to have these checkups or I call them dental health reviews, and they don't need to be longer than 15 minutes really. And we've got this subscription here where you pay like £15 a month or something in the UK, and you get your checkups and your hygiene visits included. And that's probably the way to do it once you're at that stabilized position. But you need to find a practice that's on the same wavelength. But going back to, I guess right at the beginning, we talked around the oral health routines and the brushing and the plaque. And if you've got a balanced microbiome, you've got no metals in your mouth, you have a balanced diet, you don't get ill all the time, you've got no autoimmune conditions, you don't have bad breath, you brush your tongue, you coconut oil pull, you breathe through your nose, you don't clench and grind your teeth, then there are arguments that you don't need to brush your teeth as much as you're doing, because the microbiome and the plaque that's living within the mouth is going to be a positive one that influences remineralization and healthy attachments of gum. And coconut. So my personal routine in the morning is I clear my nose with essential oils. Is kind of what I use to just clear that out after sleeping in my nasal dilators. And you'd be surprised how less your nose gets blocked if you sleep in nasal dilators, because it's holding it open, like you say. Because if you don't use it, you lose it, and all of the bits get airflow. I think it was the book Breathe by James Nestor, and he blocked his nose for 2 weeks, and it took him 3 days to unblock it after he pulled them out. So it's just like incredible. And that's just all of the bugs that were living up there and not being cleared out because the airflow wasn't, circulating it. So I oil pull in the morning, and I just use a teaspoon of regular organic cold pressed coconut oil. That's it. And I swish it around my mouth for 20 minutes as I'm getting ready, doing some exercise usually because it forces you to nasal breathe. And let's not forget, when you're coconut oil pulling, you're using your tongue to push and pull and suck and do all of these things. So you're actually stimulating your lymphatic system as you're doing it from within the mouth. So I think that's a huge thing. And there's been all of these books, hasn't there? The oil pulling therapy, and you cure diseases if you do it 3 times a day. And I wonder how much of that is actually just moving the lymphatic system to drain, and they often don't touch upon that within the books. And they say it's the coconut oil that's pulling the toxins from out the blood. And maybe it does because it's a fat that can actually pass through we know how highly absorbent underneath the tongue is. We have lots of medication that goes under the tongue. So maybe it does pull things from the blood vessels from underneath the tongue as well. But how much of it could be just the lymphatic flow within the system? So, and then I just use a very natural ozonated water or essential oil mouthwash after I've done that. Don't brush my teeth in the morning, And for me, the most important time is right before bed at night. And I've moved away in the last couple of years from the interdental cleaning you do with, I used to do with these brushes with little metal things on. And if you get the metal thing in the wrong position, you stab yourself and it starts bleeding. So I've moved into these things that are more like silicone based, and they're flexible and they don't cause any problems between the teeth. And those, for me, the hands down, the best dental tool that's been invented is the water jet, the water pick. And you just put some water in there, and you can put any type of water in there, and you just shoot around all of the gum line and all of the lower teeth, and you'd be amazed by what comes out. And no bleeding, because you're not irritating the gums, you're just clearing the debris from within them. And we have to remember that our gum is attached to our tooth, and there's a little free bit at the top, 0.5 mil, which actually collects food and debris. So you've got to go around that whole kind of scallop line of the gum to get these bits out to help clear the way. But teeth are invented, if they're in a nice straight line, to chew and to not get stuck in places. And even if there is, use your tongue. I rinse after every single meal with water, because for me, you just want to keep that flowing, moving around the mouth, getting into the stomach acid, influencing the microbiome of the body. If you've got a good one, the more we swallow 12 to 2,500 times a day. So you want a good influence, don't you? Because you're taking probiotics or pathogens that many times a day, if you think about it.
Wow, that's a good point. I'm glad you brought up the water pick. I've been doing an experiment with only using that, and it feels amazing. My mouth just feels generally better using the water pick, and I just use it once a day before bed. Have you had any patients or friends that only use a water pick? I mean, with the oil pulling and the tongue scraping, but like primarily using a water pick?
I have, and unfortunately it wasn't a good story, but he came to me saying that he had only used the water pick for a couple of years, and I had to remove some teeth that had been badly infected. But the thing is, he had other things. He had been vegan for 3 or 4 years. His nutrients and minerals definitely weren't under control. And this is what we've got to understand, that it's so multifactorial. It's not one thing or the other. And for me, I think the water pick is amazing. And for me, like oil pulling and using the water pick to clean in between the teeth is huge, because okay, so here's something crazy. When I first started dental school, and I went in with that holistic mindset, I had to do a project for public health. And one of them was coconut oil pulling and how it can help influence, and everyone just was like, what are you doing? And but the research that I delved within and got on top of, and this was several years ago now, that it was actually 50% just from coconut oil pulling. You had the patient that, this is double-blind control studies as well, that 50% less plaque on the teeth from coconut oil pulling and 50% less calculus on the teeth. Because what it does is it coats the teeth with a layer of like a saponified bit that nothing can stick to. And when it's combined with saliva and it's got all of your immune system within it as well, it actually captures the pathogens and then wipes them out with your immune system. So they found that even the microbiome changed over doing it. So that's when I started really, recommending all of my patients to do it, especially those with gum disease. And I have people reaching out that just go to the website and just follow my personal oral healthcare routine. And they message me and say, my mouth feels like a different place. I can taste differently. I can, and that's just from what we're suggesting, minimal intervention.
Wow. Yeah, I heard an interview years ago where a guy was talking about oil pulling on a health podcast, and he said the only two he's seen to work in the research were refined sesame and sunflower oil. But you're saying coconut. Have you looked at the other oils, and was there a difference? Or
I think most of them have anti properties. So like antibiotic, viral, fungal. For me, I like coconut because of the caprylic acid. That's why I like it. It's such a good all-rounder. So you've got to have the medium, the ones that have, the medium triglycerides within it. The ones that, because sometimes you can get the fractionated coconut oil, the liquid forms, which don't do the job. You've got to have the full coconut oil. And yeah, sesame for sure has very similar properties. And I don't think it really matters too much. I would use any of them, and the research shows that they are all working. And there's interestingly more and more studies coming out with it, and so obviously more people are looking into it, or more patients are asking, and then it's the minds of the clinicians then are saying, well, should we look into this really? And all it takes is the open minds of people to make the changes. And it's been an Ayurvedic practice for how many years, right? That's what people did.
Yeah. That's awesome. Well, yeah, I'm inspired to get back into it. I used to be religious with it, doing it consistently. Before we jump into the Q&A, did you want to, did we cover the conventional treatments, or did you want to highlight a few of those?
Yeah, I guess we should. So for me, yeah, it's quite interesting, isn't it? So this is just a bit of how things could influence your system. And I guess the first one is orthodontics or braces, and how that could influence your overall well-being. Especially now we're finding that if 4 premolar teeth are removed and the arches are straightened, because obviously there was this crowding within the dental arches, then obviously you can get some nice, beautiful, straight teeth with good profile angles. I'm not arguing that, but there's a book called 6-Foot Tiger in a 3-Foot Cage, which summarizes it perfectly, that you're making your mouth and the arch shape more narrow than it should be. And this is particularly a problem in the UK, because that's what we do or tend to focus on, that your tongue, do you remember when we were talking around the sleep disordered breathing, is even further back into the airway because it can't even fit in the mouth or the cage of the mouth at all. So you're then putting yourself into fight or flight more by not getting that deep level of sleep. So that's one thing to look out for. So that puts you already at a risk of not getting the sleep that your body and your system needs to regenerate, essentially. So that's number one, I would say. Number 2 is probably the materials that are within the mouth being as biocompatible as possible and as least destructive as possible. And I always say that materials need to be minimally invasive and able to stick onto the teeth as best as they can without touching the tooth as much, because something that always gets me is if you have a tooth removed, the options are have an implant or a bridge. And most patients, or a denture, and Actually, ironically, the denture, if you get a nylon one, and they're semi-flexible nowadays, are probably the most biocompatible to the body in terms of interactions within our system, and least reactive. But the options are presented with a bridge, and it's cheaper than an implant, which can be metal or ceramic nowadays. And what patients obviously don't think about is that when a bridge isn't just sticking something on the two teeth. You have to drill around the two teeth to put another fake tooth in the middle, and that's called a bridge. Now, the studies show that 20% of teeth that are crowned or drilled around die. So then if they die, then you're pushing yourself more to a root canal or another extraction, leading to a more vicious circle. So yeah, any crowns, bridges, you need to be very careful with them. And what I try to do in my clinical practice is use like inlay supported bridges. So if someone's got restorations and fillings either side of this gap, you can just remove the old restorations or fillings and you take them out, and the adhesive glues are good enough nowadays to stick this bridge in just from using the molds of the previous fillings with minimal touching of the teeth. Yeah, they might not last as long. They might not last 30 years, but if it falls out, you just re-stick it back in, don't you? Because you're not risking as much damaging the teeth. So that's something that not many think about as well, which I think is really, really important to understand. Just trying to think what other ones there are which are fascinating. Obviously, we can probably talk about the root canals, but I'll save that towards the end. I guess implants are the really interesting one, because you're basically screwing something into your jawbone and then sticking a crown on top of that screw that's within the jawbone. And those studies, what I was talking about, the metal fillings, so you've got a metal implant screwed into your jawbone, it's just bouncing straight into there and interrupting whatever might be going on within the system. So I advise patients not to get implants while they are healing, and especially if they're chronically ill, and we're removing everything within the mouth to try and help improve their wellness and their health overall, working with functional doctors, whatever it may be. And when you do get them, get the ceramic ones, because the ceramic ones really, they don't act like an antenna. And with more and more technology coming out and the 5G frequencies that are coming out, who knows how that's going to impact your overall well-being. And if a small galvanic current can run between the fillings within your mouth, the metal fillings, then having an antenna stuck within your jawbone is something that not many people think about. And obviously there's an amazing book called EMFD, and there's been lots of other ones. Dr. McCullough released that for last year, I think it was, that just highlights all of these things. And I really took my time last year when it was all being announced to go onto these summits around 5G concerns and stuff. And for me, that was enough to move out of the city and just run. So I just didn't, for me and my patients. And it's one of the most overlooked sensitivities that people don't ever get on top of, that could be influencing the mitochondria, the energy houses, everything. It's scary, isn't it, Matt? That one really scares me.
Yeah, living outside of the city for a few years, because I've moved from cabin to cabin, but I was still, I still had nearby neighbors. And once you move you don't have to be in the middle of the woods, but just to where there's some good distance between you and the neighbor with Wi-Fi, you really feel the difference. And now whenever I go to visit family in California, I'm always decked out in my EMF clothing, and I'm taking my molecular hydrogen and making sure to stay on my magnesium to protect from the calcium efflux and all the things. And it helps. I definitely feel stronger. If I didn't do any of that, I feel like I would get slammed, and it affects my mood and my energy levels. And it's a real issue. And I think the book by Mercola, it's EMF'd. I haven't read it, but it's on my list.
Yeah, it's fantastic. It's fantastic. And the studies in there are just, when it cites them and you're just like, wow. But yet none of it's exposed and no one knows. So yeah, you've really got to be your own, like you said, doctor, dentist, and researcher nowadays to get to the bottom of things. And I guess, most of your listeners will know about, root canals and how they can be a drain on the lymphatic system. And I know earlier we touched upon how when the teeth are alive, they have that outward lymphatic flow, and how porous teeth are, being like 30% porous, and then obviously the complete central part being just a hole if there's nothing alive in there. And specialists within the root canal world will seal that as best as they can with the materials as best as they can. But because the teeth are not living and there's no flow within it anymore, and if you've got all of those other things that influence the germ theory in a negative direction and make your microbiome in your mouth not positive, then you could have, a ticking time bomb released on this tooth, on a meridian line of the tooth, that is constantly draining into the lymphatic system that your body's having to deal with day in, day out. And that's what is something that I say to my patients, it's your choice. I'm just saying that these could be risks. And if someone's fit, healthy, young, they're not worried about it. I say, okay, if you're going to get it done by a specialist and pay a lot of money for it. And just realize that if we've ever got a question around health, this is probably one of the first things that we look for and test and understand. Because obviously, I think there was a study in Germany that was 96% of breast cancer patients had a root canal on the same side from the lymphatic drainage. And, that's quite scary, isn't it? And when you're aware of these things, it rings alarm bells. And I'm not saying that all root canals cause cancer. I'm not saying all root canals are bad for health, because I'm sure some people with good microbiomes are fine. And I've had patients in their 90s that are on no medication and have root canals in their mouth and they're fine. But what we need to take into account now is not one size fits all, and not everyone's immune system, detoxification system is exactly the same. And where they live, their sleep environment, everything. There's so many things that influence overall well-being now that we have to just look at. And it depends on the circumstance. And like I said, if someone's young, fit and healthy and not worried about it, and I've given them all the information, given them the books to read, given them the studies to read, and they still want it, we refer them to a specialist. That's not a problem. Not a problem at all. But for example, close to my heart, my dad was diagnosed 18 months ago with prostate cancer. And he went, I think long story short, he had his front 4 teeth kicked out when he was younger, I think 18, in a fight or something, or I don't know what happened. And he's always had this fancy cosmetic dental work with lots of root canals, lots of bridges, lots of, crowns, and, the type of dentistry that was done. And what's crazy is that 3 years before this diagnosis, he was having problems with his bladder. And we did this 3D scan and looked at it and said, you've got infections over all of these teeth. And what's crazy is that the front 4, the lower 4 are all prostate, bladder, meridian. And he said, I don't want to do anything about it, because it's quite scary, right? You've got to have all your teeth removed. You've got no, and don't get me wrong, I ended up removing 12 of my dad's teeth, 12, and they were all root canals infected, but they're silent infections. You don't feel them, and they're draining on the system. And so much so in some aspect that he had 3 root canals in a row on his upper right-hand side, and the bacteria had eaten into his sinus, which is just unbelievable. So we ended up taking all these teeth out, and he went on this, not normal, but, the alternative detoxification, no chemo, no radiation, ended up shrinking his tumor enough so that I didn't want him to have it surgically removed. But he did, because he, just wanted to get on. And now it's been a year now, and he's fine. No test results, no nothing. And who's to say how much of an influence on the meridian points or the lymphatic drainage that was having on his system, that he couldn't get on top of anything else? You just don't know, do you? So it's amazing. But I always say to my patients, if that's how far I take it to help my dad, that's got to let you know how serious I am.
That's incredible. Wow. You think someday, I don't know why I think about this often, we'll have, I don't know if it'll be stem cell technology to actually regrow teeth. Supposedly there's stories of people that have done it, kind of like a shark. It's like regrow another set of teeth. But do you think in the next few decades or something, we'll have something you could do to just, I don't know, inject into your gum and have them regrow new?
I really do. I really do. I think the technology's been around for several years now. And I've seen like
Wow.
I even read something the other day and I can't remember what it was. And it was talking around using these stem cells and, oh gosh, I can't remember the actual study now. I'll have to find it, ping it across to you maybe. But it was unbelievable with what they were doing with it. And this was all in mice, I think it was. And they were proving it in mice. So I've also seen videos online where you see these teeth growing back, and then there's these groups on Facebook that I've joined, and it's all around the belief of growing the tooth back, and people have grown teeth back, and through deep meditations and stuff like that. And the human body is amazing, I think, and if you've got that balance within it, then who knows what's possible. I've obviously not done it myself. I've not lost a tooth, luckily, but I've heard stories. I've not seen a patient that's done it either yet, but I think the technology is out there for sure, and we have ligaments within the teeth that hold the stem cells. So and that's your own stem cells if you can extract that, right? So I think it will be available, and I'll be first in line to use it, that's for sure.
That's awesome. I want to ask you about high dose vitamin K2 supplementation, and I don't want to make this a sales pitch for Mitolife, but not only my K2 that I sell, but I've had people reach out and say that they reversed a cavity using high dose vitamin K2 supplementation. And I think some of them used MK4 and some used MK7. And I think they both work to some degree. I'm more of a fan of menaquinone 7. I think it's more effective, but I've been playing around with K2, since I used to be fruitarian and raw vegan for 3 years or so. Mm-hmm. And prior to that, vegetarian for 5 years. I had a good 8-9 years of having zero K2 coming into my system, which is kind of a scary thought. But I posted an article, I think it was last year, 2017 article called Vitamin K2 and Its Impact on Tooth Epigenetics by Jan Gordelaz. And it's a pretty interesting article. It's very anti-sugar, but it has some good info in there and talking about how vitamin K2 impacts the pH of the saliva, among many other things. I think it helps just so many aspects of dental health, just the vitamin K2. So I'm curious if you've heard that from patients or seen that, because I've had people tell me all they did to reverse their cavity, all they did was high dose K2. And I forget the amounts, but I want to say it was close to 1 gram a day, something like that.
Which is a lot, but and that and when they say reverse cavity, what do they mean? Do they mean grow back enamel, or do they just mean stop it? Because this is something that I always find interesting.
A lot of them told me they went to their dentist. The dentist told them they had 1, 2, or 3, 4 cavities. They went home, started slamming the K2, went back to the dentist, and they said the cavity's gone. So I don't know the details there. That's a good question.
Yeah, and that's just me in my logical mind, because you've got that enamel layer that lives on top of the dentine layer, and within the dentine layer you actually have stem cells that use and shuttle the K2, and they're at the just above the pulpal tissue, and they can send nutrients down the tubules to fight off this ingressing bacteria. Now, for me, we have these cells called enamoblasts that create our enamel layer. And the enamel layer is when the tooth's forming, it starts on the enamel and goes down like a bell or a cap, or as it's growing down. And when that erupts through the gum tissue, those cells are left on the surface of the enamel. So within the first couple of days, your enamel blasts are gone forever, and we don't have them apparently to regrow enamel. So I've seen, this is what I've seen, that when someone's got a cavity, and what I mean is, so there's two types of cavity. There's one that's just in the enamel layer, and if it's just in the enamel layer, you can reverse it, which really means stop and arrest it. And it goes from like a light brown soft to a dark black, hard and scratchy. And that is directly linked to the amount of K2 we've got in our diet. I totally believe that, because that is the shuttle of everything, and moves things around and puts, all these minerals and nutrients back into the teeth and bones. And my favorite is the MK7 as well. So yeah, I've seen that. And then the other thing is, if it gets into the dentinal layer, you've got, let's say, split it into thirds before you get to your pulp tissue. And if it's within that top 1/3 of the dentine layer, I will say, go away, make all these changes, do as much as you can, and we'll take another X-ray in 6 months and see. And if that layer now on the X-ray is not shown up, then we don't need to do a filling. And that means remineralize the tooth, because that dentinal part can actually be remineralized. So, because that's the tubules that the body can flush things down to push out the bacteria and get things back in balance. But do I see much of it? No, because, there's books like The Dental Diet from Dr. Lin, and there's other books. The Weston A. Price books obviously highlighted it originally. And you've got the reverse tooth decay books as well. The protocols are pretty intensive in there for people that don't want to do all of that fermented food and live this crazy life that we all live. So really it comes down to commitment. But if you're mega dosing, then you've got a much, much higher, because that's all it's trying to do, right? Increase the K2 stores and bioavailability of it, which actually can do these things. So yeah, I've seen it, but not often. And it'd be really interesting to know, wouldn't it? Mm-hmm. What was shown and had a difference.
Yeah. I don't think most people are stacking the right things, or if they are stacking, say ozone, red light lasers, vitamin K2, then maybe on the side they're doing all these other things. I don't know, in my opinion, taking ascorbic acid or zinc or all these things that are counterproductive, that are decreasing the effectiveness of the other treatments that they're doing. Let's see. Well, do you want to jump into the Q&A questions? We have quite a few I'm sure we won't get through every single one, but
Let's do it.
Awesome. My friend Jordan asks, is toothpaste necessary? Because I remember learning a few years ago about glycerin in toothpaste, and there was some people saying that that's harmful to the enamel or prevents regeneration, just having glycerin, and that's in most toothpaste out there. Not sure your thoughts on that.
Yeah, no, it does. They say it prevents remineralization of the tooth itself, don't they, by coating it. So then it's stopping the when it's going back to the bacteria that coats the layer on top of it, it can't actually form those bonds and pass on those nutrients and minerals from the plaque to the tooth. But I guess you've still got the within the tooth outwards, so you've still got that happening, and that can still happen. But yeah, is it necessary? Really, it's the action of the brush, if you're removing the plaque, that does it, not the toothpaste. But the reason I like natural toothpaste, if you want to, the main ingredient for me is the hydroxyapatite, which is the substitute for fluoride, obviously, and fluoride's got systemic effects. But the calcium hydroxyapatite, will actually remineralize and help bind to the tooth itself and form that layer And ultimately, I will say, brush your teeth, spit, don't rinse, keep that layer on the tooth. And in some cases, in kids, just get them to paste it on the tooth themselves. But then, of course, you've got the other aspect of balancing the pH within the mouth using the salt, Himalayan salt, Celtic sea salt, whatever you want to do. And that's the pH neutralization of it as well. There's so many different, and the blotting technique, there's so many different techniques. And I think it's all depending very much upon the individual, and each has got to be judged on a case by case basis, depending on, there's so many tests that we can do nowadays as well to look at the bugs that are in the mouth and see which ones are more negative. And, we do that on root canals. If someone's worried about having it out or not, we can test what bugs are living within the root canal just by swabbing it with something. So yeah, there's so many factors, isn't there? And it's not, unfortunately, one size fits all. But for me, the toothpaste should be called mouth paste, because if it's a positive, neutral one with good balancing things in there, you're actually supporting your tongue, oral tissues more than the teeth. So that's a reason to use a good one, and one with as free from rubbish as possible.
I've been really loving pearl powder and just coating my mouth in that once or twice a day. 'Cause I think that has calcium phosphate and calcium carbonate in it, and then these signal proteins, and it's a really interesting product.
It's the same theory, though, isn't it? So yeah, why not? It makes sense. You're creating that layer yourself.
Yep. This is a good one. Is there a correlation between mouth bacteria and erectile dysfunction?
Wow. I've not come across that one. I've not. I'm sure there is, because to be honest with you, you can look at a lot. I don't know enough to talk about it, if I'm being perfectly honest. But for me, there must be a correlation, because I'm running through all the things that can go within the system now. And you've got obviously high levels of estrogen, which you talk about all the time, Matt, and the supplements that can cause that itself. And then you've also got the levels of bacteria. Your body has got to be in a place of wanting to reproduce to want to have sex. So you've got to be in a place of, my body is fit enough to pass on my offspring. And for me, if it's not, and you've got bad balances within the mouth, and that's circulating within your bloodstream, maybe there's an intuitive feedback loop there that links something. I don't know. But it's an interesting point, and I don't know enough about it to talk about it, unfortunately.
Yeah. There's probably, like you said, a lot going on here. Let's see. Okay, a lot of the questions were about root canals. Should you get teeth with root canals pulled? Should root canals be removed? And yeah, you kind of touched on it a little bit before, right? But right.
So for me, if you fit well, you're not worried about the root canal. Don't worry too much about it. But if you want to be as dogmatic as possible, and you don't want to have any potential risks in your system at all, and you want no oral interferences to overall health and well-being, then get them removed. And that's your own choice to make them, because there's no immune system within them. Bugs can live within them, and they can be draining on your lymphatic system all the time, potentially causing low-grade chronic inflammation within your system, which could be any one of the number of diseases that's skyrocketing at the moment, or conditions, let's call them, that is based upon just the inflammatory process in the body, because that's huge for me.
Mm-hmm. It's funny, I'm looking through a lot of these questions. A lot of them you already answered just from chatting. Should permanent metal retainers be removed? It's metal, right?
Do you know what? This is actually, yeah. So number one, even before looking at the toxicity of the metal, you've got an antenna within your mouth, haven't you? But it's opened a really good point around the balance of the mouth and the teeth. And I know we were laughing before around what potential cosmetic dentistry could do to the health of the jaw joint without thinking about it. And the permanent retainers have been put in the mouth because the balance within the body is too great to withstand not having them in. So that ergo, the teeth would move. Now, the way to picture teeth is they are sails within our body, and our bone remodels as an adult all the time, dependent on the forces that are put on it. So if I thrust my tongue when I swallow into the backs of my teeth, in the top teeth or the lower teeth, you'll be pushing them and putting pressure on one or two of the teeth, which will then force them out of the alignment again. And you'll need retreatment of orthodontics. And obviously orthodontists don't want to give you more free treatment because things have moved, and you say, why have they moved? But because they've not addressed the underlying habits that you've had. And like I said at the beginning of this, I spend 8 weeks balancing the swallowing correctly, the chewing correctly, the breathing through the nose, because air pressure influences the height of the palate and stuff like that as well, before you do orthodontics and rehabilitation, because otherwise the teeth move. So yeah, there's a few things. It depends how much you love your teeth being straight and what the alternatives for them for not having the retainer in there. So the first thing I would be saying is probably go and look at my page, I guess, which we'll talk about, and looking at the balances of the mouth and the swallowing and how you can get them into a more neutralized position without putting excess forces on teeth. And then you can think about having retainers rather than metals, which is still a plastic, but probably better because it's not in there all the time. Yeah, so I wouldn't have it in my mouth, but that's not necessarily what is. It's not in terms of metals itself. It's a stainless steel usually, so it's not the worst one in the world.
Yeah, my friend Justin of Extreme Health Radio, he got me on this thing called the neck pump. I've been using it every night. I lie in front of my fireplace and pump it up with a hand pump about 10 times, and it kind of pushes your neck up after you strap in your forehead. And I've been kind of meditating leading up to our interview that I bet I'm supporting my dental health just by increasing the amount of circulation getting to my head by decreasing the tension in my neck.
Definitely. And we've not even touched upon how the teeth influeing the cervical spine posture. Because if you've, okay, I'll talk about it now because it fascinates me as well. We work with a lot of cranial osteopaths and people like that. But if you've got an uneven bite, so I've been there and I know this. I used to have a bite that didn't meet at the back and it only meant at the front. And I had to rebalance my bite over a period of years really to get it more even. But when I had that, I had what's called a military neck, so a super straight neck that I couldn't really move too much because that was the only place that I could feel comfortable about having neck ache. And that neuromuscular feedback is like, this is a place where you are safe. But what happens is if you've got a dodgy bite or you're biting more on one side than the other, that will shift your spine every time you bite, because the muscles that are connected to the lower mandible, the lower jaw, there's about 14 of them, I think, from memory. And a lot of them, the suprahyoid muscles, which all have some kind of connection to the back of the neck or the cervical spine. And then obviously the trapezius, which is a huge muscle group. So if you've got that balance that's out of shape and it's constantly pulling to one side or the other, your brain is not going to want to look wonky. It just doesn't do it because it doesn't feel comfortable. So then your brain tells your other muscles to compensate and to re-straighten. But then you've got this slight strain going on one way or the other. And then you get this tension, this forward head posture, or this military neck like I had to hold it into a comfortable position. And then you're reducing the blood flow to the brain and the detoxification of the lymph because you're not moving it completely and full. So yeah, it's a massive thing for me, and how the teeth can influence the cervical spine is huge. And don't forget, that bite if you've got a really forward head posture or a really strong military neck, then you've got the airway at the back of the throat can be either further forward or further back. So it can influence how your breathing and air tube behind it is as well. So it can put you at more or less risk in terms of the sleep disordered breathing as well, which is just incredible.
That's fascinating. Wow. It's all connected.
All connected.
Someone asks, what kind of toothbrush is best? What are your thoughts on electric toothbrushes?
I guess it depends on the what you're going for. If you're trying to exterminate all of the plaque within your mouth, then you want some. If you're comparing plaque control and removing plaque from the mouth, the best one for me would be the ultrasonic toothbrushes that you can just brush as normal, because a lot of the interesting studies with them, some of the gram-negative bacteria that can live in the mouth are spirochetes, and they have like these long tails on them that buzz around and dive within to the gum tissue. And the ultrasonic ones vibrate at such a frequency that they actually destroy the tails on them. So they're actually quite good for balancing the bacteria within the mouth. So if you're going to go with the toothbrush route, I think Philips Sonicare, but there's other ones as well, that are more natural versions of them as well. Anything that's ultrasonic is a good one to do that because it vibrates at such a frequency. And then if you want to go down the route that's super ultra conservative for the gums and teeth, I forget the name of the one that we use. It's got like 18,000 bristles within it, and it's a bit like a microfiber cloth, for example. There's so many of these bristles that they get, and you'd be surprised. You'd feel like you're not even brushing your teeth, but afterwards they're like squeaky clean. So if you're wanting it to reduce the damage on the teeth and gums, you want like the ultra fine microfiber type bristles within the jaw, within the toothbrush.
Interesting.
Curaprox.
What are the best foods for dental health? Oh, cool. Okay.
It's a
Have you ever used Dr. Tongue's?
I've not. No, I haven't.
Okay. Yeah, I was using that for years because you just wet your finger and then it's supposed to change the polarity, when you touch the metal on the handle.
Yeah, I have. I've not used it, but my patients bring it in and show me all the time. Yeah, it sounds like it's cool. And I've not had a patient that's had it and had awful oral hygiene. So.
What are the best foods for dental health? Imagine cheese.
Yeah, anything that's going to be alkaline, but also, things that are whole food, fiber enriched, positive probiotic, prebiotic type things that support the mouth as well. For me, yeah, as long as you're eating a balanced, nutritious diet, and so here's something that actually is quite an interesting point, that our crystals of teeth can withstand 2 hours of demineralization a day, so in an acidic environment. And that's just from the nature of the inorganic material. So our enamel layer, I think it dissolves at a much lower pH, but higher acidity value. So it's like, gosh, it's testing me. I think it's like 5.4 pH value. So it's got more resistance within it. But then when you get through that enamel layer, the dentinal layer dissolves at like 6.2 or 4 or something within that remit. So depending on what's been damaged within your mouth, you kind of want to keep and when bad bugs break down food, they release more acidic environment. So, but you could eat whatever you wanted within those 2 hours and just drink water for the rest of the day, and you're within that remineralized pro time frame, for your teeth to be strong enough. And I'm not saying that's good for whole body health, but I'm saying if you're just looking at the teeth in isolation, you can eat kind of whatever you want for 2 hours a day, and the rest of the time in the day, you can be remineralizing, and you're not doing all the mouth breathing, clenching, grinding. Obviously, it's multifactorial as everything is, but that's based on purely just the inorganic component of the tooth itself. And this is where my biochemistry roundabout came into it.
Interesting. Yeah, there's something I want to try by one of my my frequent flyers on the show, Adam Bergstrom. He has this recipe for teeth healing, which is really interesting. It's basically aged cheese, garlic, and onion that you hold in your mouth for like 45 minutes at a certain time, midday. I think it's around 5 o'clock or something. And I keep meaning to try it, and it makes sense intuitively that would help.
Yeah. Then you've obviously got I find it fascinating with the organ clocks and things like that as well. When you look at what times you wake up in the morning, or when you need to go for a wee, and how that can actually be your organs cooling out. And I'm guessing it's the same for teeth meridians and things like that, but you'll have to let me know. And also get some people to send in some case studies on that, because I would love to start recommending things like that. It's fantastic.
Yeah, I think most people have access to those things, right?
Exactly. Super easy, super convenient.
Mm-hmm. This is a good one. Can white spots on the teeth be removed? And kind of in the same line, does charcoal toothpaste work?
I don't use a charcoal. So the white spots on teeth, one or two reasons. Either you've ingested too much fluoride when you were growing and developing as a baby, and that can cause the funny marks on the teeth. Fluorosis is what you call it. But actually, they're stronger than the tooth enamel would have been. So for the teeth, in terms of they're super solid. Or you have a demineralization of the tooth itself, and it starts going white and porous before you get a cavity. So first of all, you've got to balance it and prevent it from turning into a cavity. And a lot of the times it doesn't ever really go back into the same, in my experience anyway, the same color as the surrounding tooth, because of the reflection of the light based upon how porous that enamel layer is. And do you remember I talked about the enamel layer earlier not really being able to remineralize because those cells have kind of been washed away once they first come through into the mouth. But usually when it's a tiny white mark, it can be just like polished, and you can remove like the appearance of it. And charcoal I use individually, so I just get a bit of charcoal and put it in my mouth and brush my teeth with it, just to remove a bit more abrasive, to try and balance things and remove plaque. Maybe I do it maybe once or twice a week, just to keep on top of it. Maybe once a week, if I'm being honest, with the charcoal itself. But yeah, you'll find that it kind of, there's nothing left on the teeth, and it's so abrasive. So for me, yeah, I don't do it all the time.
We had a few questions on fruit. Someone said, I saw a holistic dentist hating on it lately. Did you say just wash your mouth with water? I mean, that's kind of my thought with coffee or orange juice or wine. It's generally just good to swish your mouth out right after really anything.
Absolutely. That is the biggest thing that everyone can take away from this podcast. If I've taught you one thing, it's every time you eat or do anything, rebalance the bacteria. Going back to that, demineralization process, that you can, it takes 20 minutes to come back to neutral pH naturally, just in from your saliva. But if you get water in and swish it around, you're getting there almost instantly, or more so, because you're influencing it. So you can cut down that 2 hours. So within that 2 hours that you have in a day, I didn't really mention this, did I? you have the eating period, but you have 20 minutes after eating that as well, because that's how long it takes. But if you influence that with water, you're getting there quicker. So yeah, fruit for me is part of my lifestyle. And because the sugar is packed with fiber, it's perfect. And the prebiotic and probiotic effects of how that can carry things through the system far outweigh the negatives of, demineralizing teeth. And yeah, it's perfect for me.
Yeah, and the potassium content. I think a lot of people are deficient in that, and that acts like insulin to get sugar into the cell, and so it doesn't require insulin, and it's a great food, I think.
Absolutely. Yeah, absolutely. There's so much, it's not just this one part, is it? It's the whole part. And we focus so much on these little negative points in one food group, but you miss out the whole plethora of other cellular reactions that could potentially be happening from all the other minerals and nutrients in them. Balance is everything.
It's a great point. Someone says, I have my wisdom tooth coming through at age 29. What should I do?
That depends if they like you, these wisdom teeth, or not, and what they're causing. If they're coming through in a nice straight line and you're using them to function, then they're absolutely worth keeping. If they're coming through impacted, like at a horizontal or vertical kind of way into the teeth in front, and you risk having decay within the tooth in front, a tooth that's functioning, then for me, it's worth having it removed. But wisdom teeth are the most, probably one thing we've not touched upon is what happens if you take an infected tooth out, don't clean it with ozone, put stem cells back in it, and make sure it's nice and healed properly. You could, like root canals can be this plethora of bad bugs living in there. You can have something called a cavitation that lives within the jawbone from a root canal that you just take the tooth out. You've left the periodontal ligament in there. You've left most of the infection underneath. You've not scraped it out, cleaned it out, and packed blood in and ozonated it. Root canals are the most common sites to have cavitations within them. And before I get to the surgeries on my patients, I always cover the least invasive, low-hanging fruit things like the breathing, the sleeping, the balancing of decay, the metals, all of those things first. But some patients, we do have to go as far as removing infections from jawbones from previously extracted teeth that haven't been done properly. So for me, when you have these teeth removed, you obviously want to go to someone that's on the same page and have them ligaments scraped and cleaned out, because there's always a risk of leaving some bugs within there, especially if you're in a place of not good balance anyway. Don't get me wrong, some people can heal fine. It's again managing risk, isn't it, as always?
Fascinating. Let's just do a few more here. We haven't talked about this. Is flossing worth it?
Well, you can get some pretty nasty material and substances on floss. Some of them are coated with like toxic plastics and adhesives to work. And not to mention, if you floss wrong and you make your gums bleed, then you're allowing bugs into the circulatory system, which can cause problems. But I think nowadays there's definitely more. The other thing is the root morphology of your teeth. So your molar teeth, from your premolars, backwards, so after your canine teeth, they have funny shaped roots. So floss doesn't get the whole way around the root. It doesn't clean it effectively at all. You need either something with little knobbly bits or bristles or the water going through it to clean those areas out. Because floss, if you imagine there's an indentation within the tooth and you've got this little bit of string that goes down and up, you're missing this whole indentation of stuff that could still be living there if you're worried about plaque control and you've got a disease that you're trying to get on top of. But for me, if you're going to do it, you only do it on the front 6 teeth, upper and lower, because they're the ones that have straighter roots that you can curve around the floss around it. But floss is probably more one of the highly technical interdental cleaning techniques, I would say, that can cause more irritation to the gums than removal of plaque. So you've got to be doing it for a while to get good at it. And for me, it's only worth those front, upper and lower 6 teeth, which is canine to canine, if I'm being honest. And there's better ways of using the water pick or oil pulling. Don't forget, oil pulling pulls things in and out of the teeth, which is much better at cleaning in between the teeth. And the little silicone type, like they're called easy picks, and they're like, don't hurt your gums, and you just push them in between, and they're very good. And I use them mixed with the water pick is what my routine is.
Awesome. Yeah, I wish I had the water pick earlier in my life, because I remember growing up, one of my least favorite things about maintaining my teeth was flossing. I would just always bleed, and I would go up too much, and it would just bleed for minutes, and it was not fun.
From a dental perspective, a selfish perspective as well, if someone's got lots of crowns on them and they're flossing, they always pull their crowns off.
A few people, let's finish up with this one. They asked about homemade toothpaste, like baking soda and coconut oil. They said some people say it's abrasive or too abrasive.
I don't think it's too abrasive, personally. I think it's a really good one because you've got the alkalinity of it, and you've also got the antibacterial effects of the coconut oil as well. So as long as, the thing is, you can try as least toxic as possible, and as long as you're getting checked out and your dentist is happy with the balance of within the mouth, then you've got no reasons to be worried.
I love it. So, Dr. Seb, this was awesome. I'm inspired to get back on my copper tongue scraper and the oil pulling. Excited to see how that feels after a few months of getting back on it. Just fell off the wagon. And this was great. It's fascinating. Your website's wonderofwellness.co.uk. Is that right?
Yeah, that's it. That's the general info that I put out there, but I do a lot more on Instagram at the moment in terms of the newer research and newer things that I'm kind of thinking of. Which is biological_dentist. But I need to do more. But it's balancing the time between working on clinic 7 till 7 and doing social media as well. But I think it's so important that the message is out there because these things are not talked about, especially in the UK. I think I'm really one of the only socially media active biological dentists anyway.
I haven't seen many of them. Yeah. And you even offer online consultations. Is that right?
Yeah, this is something that I've only just started introducing, and I wasn't sure whether people would get much value of it, but they really have. I've been really quite surprised because we can talk around all of their individualized concerns, and all we need is 20 minutes a lot of the time. And it's just reassurance from the direction that they're taking and, understanding of different things that could be contributing to things. So yeah, we do. At the moment, I've got an afternoon on Fridays that I tend to do with just online consultations, but it's really tailored to that person. And, I was really surprised at the value that they get from it, and introducing things like we've talked about on this podcast. So maybe they don't need to come on now. We've spoken about it all, but, even like the nasal dilators and just seeing what they can do to impact their sleep and myofunctional therapy and habits and breathing. So it's things that people and other dentists don't often think about, right?
I think it's all great stuff. And yeah, I highly recommend checking out Dr. Seb's Instagram. Yeah, you have a lot of great posts on there, and there's things to implement, free information. So thanks so much for coming on the show. This was awesome.
Thank you so much. Thank you so much for having me. And I hope it was an enjoyable one for everyone. I never knew that dentistry would be blowing up as much as it could have been on my social media. So it makes me very happy.
It's great. Yeah. And I think if we can catch people early enough, It's like that saying, an ounce of prevention is worth a pound of cure, right? Like, you want to catch it early and before it's too late.
It is so, so true.
Right on. Well, thanks, Dr. Seb. Stick around as I close out the show. Wow, that was really fascinating what he said about metal toxicity closing down meridian lines or blocking them from activating. I also found the galvanic current running between the metals in the mouth really interesting. It just adds such a layer of complexity to human health when dentists put metal in the mouth. I thought it was fascinating that the mercury filling is only a small part mercury. Like you said, it's mostly silver, tin, copper, and zinc. And mercury is just the glue holding all that together. But it doesn't take much. Just a tiny amount seems to ruin lives. I've heard so many stories of people getting those out and regaining their health after trying all these different protocols and devices and supplements, and nothing worked until they fixed their dental health. I've been really inspired since speaking with Dr. Seb to get back to oil pulling. I was religious with it for several years. First thing in the morning, I would oil pull, and at some point I just stopped. So I'm back into it first thing in the morning, grab my jar of coconut oil, take a spoonful as I'm doing my routine, my ozone, juicing my oranges, whatever it is, and just swish that around, and I shoot for 20 minutes like he does. And I found my copper tongue scraper. So I've been tongue scraping as well. And my experience with that has been really interesting. If I've ever had like an allergic reaction where dust gets kicked up and I can't stop sneezing, I'll tongue scrape. And a lot of the time it will stop the sneezing immediately. I have no idea how that works, but I started to scrape my tongue again. So my routine has been to oil pull first thing when I wake up and then tongue scrape at night. And I've been using the water pick, the water flosser. And that's it. That's all I'm doing right now. Brushing to me feels a little too abrasive, so I'm experimenting. I don't recommend it, just using a water pick. I think there's a lot of things at play, but for me, my mouth feels so good just using a water pick, oil pulling, and tongue scraping. So I'll put the links below where you can check out Dr. Seb and his work. It's wonderofwellness.co.uk. And you can click on appointments on there, online sessions, or if you're in the UK, you can do an in-person. And his Instagram is biological_dentist. Really great information that he's sharing. I was so confused about dental health for several years and going back and forth with different protocols and beliefs. So I think it's really helpful to pick the brain of someone that's been studying it for a long time, and someone like Dr. Seb that has a holistic, broad approach and understandings of health systemically and how that interlocks with dental health. I'm definitely going to have more shows about dental health in the future. I think there's so much more to explore with nutrition, and especially vitamin K2 and magnesium, and all of these nutrients that nourish the teeth from the inside out. You can check out my work at matt-blackburn.com. I have my recommended products up there, recipes, the CLF protocol. And on the main page, if you scroll down to the bottom, you'll see shop on my Amazon store. And my friend Justin over at Extreme Health Radio just introduced me to something that's really cool. It's called the posture pump. And I put that under my biohacking section there on the Amazon store. And what's really cool is that it actually restores the natural curvature of your neck. So basically reverses text neck, or if you're on the computer a lot, or if you drive a lot, it's really easy to get that forward kind of straight cervical posture. And so this actually puts pressure on your neck and opens it up and actually hydrates the discs in your neck. So it's actually a way to hydrate the fascia and the muscle. It's really cool. And I felt it immediately the first few minutes when I opened it up and started using it. It feels just incredible. Then Mitolife is my brand. You can find that at mitolife.co. And as of this recording, we have NAD power back in stock and a new product in stock called Mag ATP. This is a capsuled form of magnesium. For several years, I've been promoting homemade magnesium bicarbonate, which is a liquid. And now I'm finally coming out with my own magnesium product. It's not a liquid form because there's crazy logistics that go into selling a liquid product. So for whatever legality reasons, it's a lot easier to sell capsules and powder. But these are forms that I've been taking for several years now, bisglycinate and taurate, which are amino acid bound forms of magnesium. So unlike oxide, carbonate, citrate, and other suboptimal forms, these are actually highly bioavailable and effective. I love taking 3 of these capsules with my espresso in the morning. So really the combination that I love is orange juice and then breakfast with Shilajit tablets, niacinamide, and these magnesium capsules, and then some espresso and maple syrup, and my brain is always on fire after that combo. And then I have a private YouTube school called Mitolife Academy. I put out 4 private videos a month if you sign up for the advanced one, and 1 private Q&A. It's usually at least 2 hours long where you can ask me any questions, and I share my latest experiments and research and new supplements or devices that I'm trying. So I'll put all the links below where you can check out all of that. And thank you guys for listening. Hope you're having a great 2022 so far. I will see you next Friday. Stay supercharged.